Hi, you guys. Welcome back for our daily practice questions. It is day 138 and day 8 of our Pharm series. But as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flash, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any other questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number 1 for today. And don't forget to hit that subscribe button so you don't miss any of my videos. Question number 1 states, what is the standard initial treatment regimen for active pulmonary tuberculosis in an adult patient? Is it A, rifampin and INH only for 6 months? Is it B, INH, rifampin, pyrazidamide, and ethambutol for 2 months? Is it C, azithromycin and doxy for 4 months? Or is it D, rifampin monotherapy for 12 months? Take a moment and tell me what you got. All right, I always recommend reading the stem of the question first as it allows you to slow down to ensure you're answering what is even being asked of you. But here, the stem is the question is the stem, and it states, what is the standard initial treatment regimen for active TB in an adult patient? And your best answer is B. Remember the acronym RIPE, RIPE, for your standard active TB treatment, which is your rifampin, the I for the INH, the P for pyrazidamide, and the E for ethambutol, okay? Question number 2, what is the duration window of treatment for active tuberculosis? Is it A, 4 to 6 weeks? Is it B, 3 to 6 months? Is it C, 4 to 9 months? Or is it D, 2 to 3 months? Take a moment and tell me what you got. Again, the stem is the question is the stem, and it states, what is the duration window of treatment for active TB? And the best answer is C. We can treat from anywhere from 4 to 9 months, typically starting out in that 4-month range. And typically we see it treated on average for 6 months because we'll do the standard initial treatment for 4, and then there's an additional 2-month period of therapy as well. But it can range anywhere from 4 to 9 months based on the case. And then lastly, question number 3, which of the following TB medications is most commonly associated with visual disturbances and requires a baseline eye exam? Is it A, rifampin? Is it B, INH? Is it C, pyrazidamide? Or is it D, ethambutol? Take a moment and tell me what you got. All right, STEM is the question is the STEM, and it states, which of the following TB medications is most commonly associated with visual disturbances and requires a baseline eye exam? And your best answer is D, ethambutol. I always say think E for eyes and E for ethambutol. Remember, when you're prescribing the ethambutol, you want to make sure you get a baseline eye exam because it can cause visual disturbances. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the Nursing Studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the Nursing Studio, the number 1 at gmail.com. Everything that I do offer is linked in the bio of this channel. And as always, if you're looking to book any of my one-on-one sessions, any of my question analysis sessions, or any of my custom packages or plans, I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure you're booking the appropriate session type. All right, y'all. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.